Hello, I'm Dr. Sundari Mase, the Sonoma County Health Officer. I'm here to share the latest updates on coronavirus in Sonoma County with you. But before we get to our regular briefing, I'd like to make a short statement regarding an incident that happened on Friday. I wasn't there, but a public Zoom meeting hosted by our county leadership was forcefully interrupted by unknown individuals that directed racist epithets and sexist remarks to staff in a threatening manner. We wholly condemn racism, sexism, and violence. The county is responsible to serve everyone in the community, including some of the most vulnerable, and we do so with equity and empathy. We'll continue doing this important and much needed work in our county. So thank you for your understanding. As of yesterday, July 12th, we have 1,819 confirmed cases, up 258 over the weekend. 827 are active, 976 are recovered, and now we have 16 deaths, an increase of 2 deaths over the weekend. Both persons were residents at a skilled nursing facility and over the age of 65. As we know, COVID-19 can be much more deadly for this age group. We have done over 59,000 coronavirus tests, with 1,312 of those during the weekend. The rate of positive cases is now 6%, and this reflects a 7-day average ending June 30th. Our case rate is at 124 per 100,000, 24 above the state's threshold, which is one of the main drivers behind the enactment of new restrictions to reduce the spread of the virus. In light of the restrictions that went into effect today by order of the California Department of Public Health, with a late-breaking announcement by the governor of additional closures, I would like to talk with you about the reason for this development and actions we as a community and as individuals must take to address the surge in cases so we may get back on the path towards reopening the county. As you know, Sonoma County's health orders have been following the state's benchmarks for operating businesses and public spaces. In regard to the restrictions that went into effect today and additional ones that were just announced, we are now under the state health officer's order, and there's no flexibility with these orders. Businesses and public spaces are categorized based on risk level, and these are the criteria for opening and contracting operations in considerations of where we're at with the virus. The most recent closures reflect places and activities where the following high-risk activities are likely. Closed spaces where maintaining 6 feet of physical distance is challenging, if not impossible. Difficulty in adhering to facial covering rules in these settings, and gatherings of greater than 12 people outside of one's immediate household members. These places include offices for non-critical sectors, restaurants, wineries and tasting rooms, fitness centers, places of worship, personal care services, hair salons and barbershops, malls, movie theaters, zoos, museums, card rooms, and bars, clubs, breweries, and distilleries. According to our rising numbers of infections, just over 10% have originated from community spread, and nearly 40% are still under investigation. We know how these restrictions cause significant hardships to businesses, employees, and consumers. Among the ways we contain this highly contagious virus is by testing, contact tracing, and separating people known or suspected of having COVID-19 from others through quarantine or isolation. Adding to the complexity of containing the novel coronavirus, we know that upwards of 40% of people infected with COVID may be asymptomatic, meaning that they have no symptoms, pre-symptomatic, meaning they're sick but don't yet feel sick, or have very minor symptoms, meaning they may feel like they have seasonal allergies or a cold. Nevertheless, regardless of symptoms, if someone is infected, the person may be able to pass the virus to others. The old saying, out of sight, out of mind, comes into play, and coupled with our eagerness to go on with our lives as before, this attitude may lull us into forgetting to practice behaviors that will protect ourselves, our families, and our overall community. Facial covering, physical distancing, frequent hand washing are the 3 actions to take to reduce your likelihood of either getting sick or passing on COVID-19 to others. Let's work together to bring our numbers down so we may reopen safely again. Thank you. Have a safe 2 days, and I'll talk with you again on Wednesday.